Hi, and welcome to this episode of Financial Planning Innovation. It's my pleasure to have on the line Frank Samson. Frank and I have done podcasts together. He hosts a podcast called Boomers Today. He's the founder of SeniorCare Authority, and he's just a knowledge expert in the elder care world. Thanks for joining us today, Frank.
Mark, it's a pleasure to be here. You were on my podcast. I'm thrilled to be on yours.
Awesome. Well, how did you get into this business? I know you had a different career you started with, and you ended up in this elder care and placement services business. Tell us a little bit about your path to get there.
Yeah, I was always interested, in elders and working with seniors. I always enjoyed that. But I was in a totally different industry. I was in the travel industry for many years. And shortly after I sold my company in the travel industry, my parents had some illnesses. And
Mhm.
shortly after I sold my company, both my parents passed away 7 weeks apart from one another.
Mm.
So it was obviously a pretty stressful time leading up to that, and certainly very stressful around that time. And after I sold my company, my plan was to figure out what I wanted to do the rest of my life. So it was almost like a light bulb went off, and I said, "This is a business that I want to get into to be able to help others because it was so difficult." And I felt with the boomers, and I'm one of them,
Mhm.
um, aging, how are they going to deal with all of this?
Yeah.
And so I did. I took literally over a year off and just researched the industry
Mhm.
and started SeniorCare Authority in 2009 in Northern California,
Mhm.
and basically just started from scratch and learned. After I after I talked to people all over the country, and I did travel all over the country, I zeroed in on this niche business,
Right.
which is basically what I'll call elder care consulting, with
Mhm.
an emphasis on placement. Placement being helping families find assisted living, memory care, finding the right places to live and get the proper care. But
Mhm.
then we've also incorporated consulting work along with it.
Awesome. And it's very closely connected to my world, the long-term care insurance space,
It
because
is.
the big question we get and all of the specialists in our network get from clients, 20 years, 30 years after they buy an insurance policy is how do I activate this and who are the providers I should use? And that's really where you guys come in and helping guide the families as to which providers are
Yeah.
available in their areas.
When we hear, it would make our job a lot easier if everybody had long-term care insurance. And you'd be happy about that as well.
Right.
Yeah, when we hear they have long-term care, it gives us a lot more flexibility, and but we're there it's still a difficult process, but you take the financial part of it and say, well, now it's a little more palatable because they have the insurance, so that's great.
Yeah.
Tell me more about what you do.
So you built this model in the Northern California area and kind of perfected it, and then you kind of franchised it out nationwide. What does your business look like today? How many franchise owners do you have?
Yeah, so we have about 75 locations around the country, and we're setting up in Canada this year.
Cool.
Hopefully, if somebody looks at this video in a year or two, we'll be all over Canada as well. Um, a- so the reason I decided to franchise it
Hmm.
was because I learned that this business, when I did it myself, and I did it myself for 5 years before deciding to franchise it, is this is not these people are not commodities. These are people that need help. The adult children need help. It's very stressful. Um, People that are confronted with it have never been confronted with it before and don't know what to do. So I felt it was really important to have local advisors, local people from their community to be able to work with them. And that was why I did it on a franchise basis versus setting up a call center somewhere to try to service
Cool.
people.
Now, I want to learn a little bit more about the client experience and how they work with yourself and your franchise owners. What you mentioned, elder care consulting. What type of services are you providing for your clients?
Yeah, so it could be a number of things. I'll give you a couple of examples. It'll probably be the best way to get the point across. Many times you know, myself or our franchise owners, when we first talk to a family and we going through kind of the assessment with them of the situation. We're talking to the adult children, and we'll say, well, you know, do you have any brothers or sisters? And we'll talk about that and find out, not in all cases, but in many cases, uh, they're not all getting along on
Hmm.
what the next step should be for mom or dad. The sister, the daughter I'm speaking with says, well, I see, I think we should move dad into some sort of assisted living, but my sister thinks we should find a caregiver at home. And my
Hmm.
brother is in total denial. He doesn't think anything's wrong with dad. He's going, what are you talking about? Dad's fine. Right? So it's not, it's pretty typical. So many times we're just going to go in to meet with the family or set up conference calls if people are in different locations and try to just talk them through, give them a reality check on the steps that should be taken, uh,
Hmm.
and give them guidance on that. So that's one example.
Hmm.
um, Sometimes it's just difficult situations. I just don't know what to do. Mom left the stove on last night. I don't know what to do. Or we find out that after we assess the situation, they're going to need some legal advice and put them in touch with the proper elder law attorney. They're going to need financial, maybe a little financial planning advice.
Hmm.
Maybe they're a veteran or a surviving spouse of a veteran. We can help them through that process of getting money through the VA.
Hmm.
They do have a program. It's one of the best kept secrets around.
Hmm.
So there's a number of different things that we're going to help them with from a consultative basis that may not be directly related to finding assisted living or memory care
Right.
for a loved one.
So there's that consulting aspect, and then you've kind of coupled it uniquely with the placement model. What does the placement part of your business look like?
So placement is, as I say, is helping them find the right place to live and get proper care. Many people call it nursing homes. All right, so nursing homes in the 1990s is when assisted living started being licensed. All right, so possibly, I don't know, maybe not your grandparents, my grandparents. I mean, if they weren't at home, they were in nursing.
Right.
That was the only option. All right. And assisted living is kind of that in between. It's
Hmm.
more of a homey environment. All right. And nursing is a medical model.
Hmm.
Assisted living is more what's called a social model. But again, they're being cared for and all that.
Hmm.
So what we try to do is to, if it's the right fit, to help people find assisted living
Hmm.
or memory care, which is that in between model
Hmm.
between being at home or nursing. If nursing is what's needed, because the doctor says that's what's needed,
Hmm.
or they're in a situation where maybe they're on Medicaid, California we call it Medi-Cal, it's called different things in different states. Um, we can also help with that, but that kind of falls under our consulting. The reason is nursing is not allowed to pay a commission, and
Hmm.
we earn our money from a commission from the assisted living community, uh, and that saves the family from having to pay us any type of a service fee for that function.
I
Well,
see. So
we do. Yeah.
So the assisted living facilities have built in the cost of your services into their model, and your job is to assess all of those assisted living facilities in that geographical area with your franchise owners.
Exactly. And we do. And even though they might be willing to pay us a commission, if they don't have a good track record, we're not going to take people there.
Right.
You know,
Right.
we do a lot of work and seeing if there's citations, complaints, anything like that ahead of time. So we're only, taking people to, uh, the better places from a care standpoint. And,
Hmm.
and because they're good from a care standpoint, that doesn't mean they're most expensive. So
Right.
I used to have a rating system. I called it the star system. Like it came from the travel industry. So we
Hmm.
were rating them 5 star, 4 star. Well, if I say 5 star to you,
Yeah.
you think that's the most expensive place, right? So I changed it. It's now called a care system. So it's a 5 care, 4 care, 3 care.
Cool.
And the care system is totally based upon the level of care. It may or may not be expensive, it just depends on,
Yeah.
each one.
And And the thing that I like that's so innovative, and this is a financial planning innovation kind of series, is that you developed a rating system on your website to evaluate the local facilities, and you have like a list of all the facilities in that geographical location.
We do, but that rating system is not being rated by us. That rating system
Right,
is the consumer going to our site like a Yelp
right,
and going in and rating it. So it's like we have our own Yelp, but again, that's totally based on what the consumer is saying.
yeah.
We have our own internal system that we only share with our clients. We don't publicize
Okay, very cool. Now, I wanted to kind of, give people an impression of what this looks like. Most people out there, they think about long-term care planning, they're thinking about, staying at home, but oftentimes that's not necessarily what's in the best interest of the client. Sometimes they need to go into an assisted living facility. Tell us about the story. I know you had, in your career, you'd worked with families like this. Can you tell us a little bit about a family that had
Yeah,
that
yeah,
situation?
I'll tell you about a family. I actually highlighted this story in a book I wrote called The Aging Boomers. But the story is a family in Northern California, where I'm based, and the daughter was referred to me, and she was in a kind of a difficult situation. And what she explained is my mom has been diagnosed with Alzheimer's. My dad is taking care of her. He has some physical challenges, and I her opinion was we need to find a place for her. Um, and found out that the family was a little bit dysfunctional. I mean, the brother, sister, weren't helping. They didn't, the brother lived in another country and really wasn't partaking. And
Hmm.
so everything was falling on her to
Hmm.
take care of these things. She worked full time, and she had kids. She was a perfect sandwich generation, as we call it,
Hmm.
situation. So she was really looking to me for guidance and what to do. After spending some time with her and learning more, and giving her introducing her to people, elder law attorney, etc., so they could get things in order, and
Hmm.
neurologists to kind of reassess the parents and all of that. I did go and visit the parents and realize that the situation was actually worse than,
Hmm.
than she had even
Hmm.
told. Uh, my opinion, and again, I don't have a medical background, but I dealt with enough families to know that I felt also the father probably had early stage of dementia.
Oh,
And here's somebody who has early stage dementia taking care of someone who has been diagnosed with Alzheimer's. We ended up getting him assessed, and he did. So we're sitting there with two people living alone, both with dementia in the same place. All right. And the challenge was the father was pretty set in his ways. He wasn't going anywhere.
hmm.
Certainly, we guide families all the time on having the talk, as we
Hmm.
and the approach to take, and how to word things, and all of that. And there's actually somewhat of a science to it, but it doesn't always work. It works in a lot of cases. It didn't work here,
Hmm.
where the father doesn't matter what was told. I mean, to the point where the daughter was crying, saying, "Dad, this is causing so much stress on me and the family, and I can't work." And he goes, "Okay, I'm not going anywhere."
No.
So we had to get a little innovative, and they happen to have been living in a very nice mobile park. So they had a mobile home. It was very nicely done, a nice neighborhood. And the daughter had told me that there were some complaints from neighbors. Also, the landlord was very concerned because the mother had, walked and gotten literally got lost a couple of times, and they had to go find her. On one occasion, they had to call the police to
Mhm.
find her because the father couldn't even keep up with her because he had some physical challenges. So I had this idea, and I talked to the daughter about it. So let's go talk to the landlord. And I bounced the idea off of her, and she said, "Yeah, let's do it." And basically, what we had said, "Hey, these people aren't safe, but we can't drag them out of here, and we're going to have a bad situation happen if we don't do something." So my idea to the landlord was, can you turn off their power? Will you be willing to turn off their power and turn off their water? And then go talk to them and let them know that you had this horrible situation occur, and temporarily they're going to have to move out until the
Mhm.
situation is rectified. So obviously they went, yeah, I know we can't live here without electricity, without water. So they told the daughter about it, and the daughter says, well, again, remember I told you about this place that uh, nearby here that we could go to? I found, I'll check, and we could go there temporarily.
Mhm.
So father said, okay, really have no other choice. Let's go. And we moved the two of them there, and they were cared for, and that's where they ended up living the rest of their life.
Wow, wow, wow. It's like one of these "don't try this at home" type of stories, yet we all can kind of relate, a little white lie to do what's in the best interests of these folks.
We were doing to keep them safe. This
Yeah,
was to keep them safe.
yeah,
And
yeah.
you think legally, are we doing anything wrong? Legally, if we drag them, that we're doing something wrong.
Right, right. Yeah.
So we had to get a little innovative to keep them safe and have some sanity for the family and all of that.
Yeah, and I know people listening to these stories are not in their heads. Everything you're touching upon, the daughter having to take care of this, the stress, people not wanting to leave their homes, of course, but going through that process and having someone to guide you, and that with what you guys are doing there, I mean, I think that's so awesome. So, thanks for joining us today on the show. I know we're going to do future episodes as well to
Yeah,
talk about more of these
I really
stories.
appreciate it. Thank you for having me. I really appreciate it.
You're welcome. Talk to you soon.
All right, great.